Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, please press star then 0. I would now like to turn the conference over to our host, Supervisor Kathryn Barger. Please go ahead, ma'am.
Thank you. Good afternoon, and thank you for joining us here today. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors, and I want to thank all of our viewers for tuning in today to stay informed about COVID-19. I'm grateful for every person and organization who is doing their part to protect our health and to protect our community. There are many groups teaming up to find and meet the needs throughout the region. I'd like to share about a valuable partnership, the BizFed Institute, which is developed alongside the Los Angeles County State Legislative Delegation, the Hospital Association of Southern California, SEIU, and Los Angeles County. These partners are mobilizing collections and donations of much-needed equipment to protect our frontline workers. This effort has been an incredible success so far. The initiative facilitated a donation of 50,000 non-medical disposable face masks by a group of donors represented by the U.S. Zhejiang General Chamber of Commerce President Lin. I was proud to greet the donors at our county warehouse last week and thank them for their generosity. The masks were distributed today to the Dream Center, Shelter Partnership, Goodwill Southern California, the SEIU locals who have many on the front lines each and every day helping the people, and Watts Healthcare Foundation. BizFed Institute has also facilitated donations for 250 N94 masks, 640 other types of masks and face coverings, and 750 pairs of gloves. With its vast connections to business and civic leaders, BizFed Institute is spearheading this innovative effort to find and distribute safety supplies for those who truly do need it most. To find out how you can donate and receive supplies, or for more information, please visit bizfedinstitute.org. Again, that is bizfed, B-I-Z-F-E-D, institute.org. These unique partnerships like to remind us that we can do very much when we work together. We can meet the needs of people across Los Angeles County. I'm certain now more than ever that our unity will help us overcome the crisis and enable us to rebuild our communities even stronger. We are increasing our efforts to slow the spread of the coronavirus every day, and we remain focused at bringing our communities into the recovery as soon as possible. In addition to the daily case count from the Department of Public Health Director, Dr. Barbara Ferrer, we will also hear from District Attorney Jackie Lacey, who will discuss her efforts in response to the COVID-19. Combating COVID-19 really takes each person throughout Los Angeles County and in each of our neighborhoods to do their part. I'd now like to invite Dr. Barbara Ferrer up to give her daily update. Thank you.
Good afternoon, everyone. Thank you so much, Supervisor Barger, and to the entire Board of Supervisors. I know that I, along with all of the residents in the county, are very grateful for your leadership and all you've done for LA County during this most challenging time. To update you on our current status, I'm really sad to report 55 additional deaths today. This is the highest daily total we've reported after reporting high totals both yesterday and the day before. And it really reflects the devastating power of COVID-19. 43 of the people who passed away were over the age of 65, and 39 of the people who were over the age of 65 who died had underlying health conditions. 9 people who died were between the ages of 41 and 65, and all of these people had underlying health conditions. I don't have information at this point on the 3 cases that are being reported from the 2 other city health departments, 1 case from the city of Long Beach and 2 cases from the city of Pasadena. This brings the total number of deaths to 455 in LA County, and our mortality rate is now for COVID-19 is now 4.2%. 88% of people who have died from COVID-19 have had underlying health conditions, underscoring the need for all of us to work together so that we make it possible for those who have underlying health issues to remain safe in their homes. 2 of the deaths that we reported in yesterday's total were found to be out of our jurisdiction. For the 390 deaths where race and ethnicity has been identified, 16% are African American, 17% are Asian, 33% are Latinx, 31% are white, and 3% of the people who passed identified with another race and/or ethnicity. We are working with our community partners to respond to the disproportionate number of deaths among African Americans. This includes addressing issues related to access to testing, health services, and accurate information about COVID-19. The grief experienced by the families and friends of the people who have died from COVID-19 is overwhelming, and we're mourning with you, and our thoughts and prayers go out to all of you. Today, we're also reporting 399 new cases. Over the last 48 hours, there have been 871 new cases. This brings our total to 10,854 cases throughout the county. These cases include 379 cases that are reported by our partners in the city of Long Beach and 184 cases reported by the city of Pasadena. We're also confirming 33 positive cases among people experiencing homelessness. The majority of the people who are positive for COVID-19 and are experiencing homelessness are unsheltered. 7 people were sheltered in 6 different shelters, and they're all appropriately isolated, and their close contacts are now quarantined. There are 2,847 people who at some point have been hospitalized with COVID-19. 26% of all positive cases for COVID-19 have been hospitalized at some point. There are currently 1,587 people hospitalized. 32% of these people are in the ICU, and 22% of these people are on ventilators. And as a reminder, COVID-19 causes very serious illness and even death. We're also investigating 209 institutional settings where there is at least 1 confirmed case of COVID-19. This is 4 additional investigations since yesterday. And as a reminder, these investigations are happening in nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings keeps growing up, and we're now at 1,963 cases. 1,050 of these confirmed cases are among residents, and 913 are among staff. And we're sad to report that 158 residents have died from COVID-19 who were residing in institutional settings, and this represents now 35% of all of our deaths. Most of the people were residing in skilled nursing homes, with a small number of people in assisted living facilities. We've assigned additional Department of Public Health staff to increase our support to nursing homes and assisted living facilities, and have also assigned a team to help ensure that there's adequate personal protection equipment for all employees. We're hoping to be able to post reports starting next week that include the following information from all institutional sites with positive cases: the number of positive and suspect cases among residents and among staff, and the number of deaths. We will also be working with nursing home providers to increase sites that can serve COVID-19 positive patients safely who need to reside in skilled nursing facilities and intermediate care facilities. Today I'm reporting 71 confirmed cases have occurred at some point in time in the jail facilities. This was included 15 inmates and 56 staff. Today, the sheriff is reporting that there are 13 inmates currently who have tested positive. The 2 additional inmates have recovered. 42 folks who are incarcerated are in isolation, and 943 people who are incarcerated are quarantined. There are 50 cases in the state prisons, 39 inmates and 11 staff, and we received a report today of 1 case in the federal prison among a staff person who unfortunately has passed away. We have no new cases in the juvenile facilities. We do post a list of facilities with confirmed cases on our website once those sites have had an opportunity to notify all their staff, residents, and families. And you can see the updated report of all LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The LA County Sheriff Department is reporting 38 positive cases among staff. There are 458 staff quarantined, and 294 staff have returned to work. The LA County Fire Department is reporting 17 positive cases amongst their staff. There are 16 people who are quarantined at home, 3 who are home ill and isolated, and 14 who have returned to work. Thanks again to Sheriff Villanueva and Chief Osby for tracking and reporting this data. Over 70,000 people have been tested and had results reported to LA County, and among those tested, 11% were positive. There are 3 new testing sites that have opened this week to increase testing availability for symptomatic individuals. And I know that tomorrow Dr. Kazan will be here to talk more about the testing capacity across the county. I do want to clear up any confusion there may be about testing and the different kinds of tests that we're all hearing about. If you're having symptoms and you want to be tested for COVID-19, you should be tested with a test that we call a molecular test or a PCR test. And these are being used by providers and are being used at the testing sites that are across the county. This test is able to tell you if you're currently positive or negative for COVID-19. These are the only tests that are appropriate for diagnosing COVID-19 at this point in time. Yesterday, I talked a bit about our study that tested a random sample of LA County residents with a serology test. And what we'll learn from these tests is who has, at some point, been infected with COVID-19. But this antibody test does not detect if the virus is currently in your body. It only shows if your body developed antibodies at some point in response to the virus. It doesn't tell us if a person is currently COVID-19 positive. And unfortunately, because we don't have a lot of good information yet, it doesn't even tell us if a person has developed immunity to COVID-19. What it does do is it gives us valuable information about how many people have become infected with COVID-19 in LA County, regardless of whether they ever became sick and/or they ever were tested. It will also give us some information on what groups may have been affected by COVID-19. And we're very much looking forward to sharing with you the preliminary results from this study very early next week. But just as a reminder, for diagnosing, serology tests are not appropriate. Molecular tests, such as those being used at our testing sites, are the correct tests for diagnosing a person with COVID-19. And I want to again acknowledge and thank Dr. Kazan and the Fire Department for significantly increasing capacity for symptomatic people to be tested by creating regional testing centers throughout the county. And many of these sites have appointment slots that are available for people with symptoms who need to get tested. So please go to covid19.lacounty.gov/testing for a list of testing sites and to schedule an appointment. I also want to mention that if your income has been affected by the COVID-19 pandemic, and we know for so many residents here in the county, they have lost work and maybe even been furloughed from their jobs, and you're pregnant or you have a child under 5, I want to make sure people know that the WIC program is here to help. WIC, which stands for Women, Infants, and Children, provides food benefits and other resources to eligible families. And to find out if you're eligible, you can call 888-942-2229 or visit phfewic.org. Every day, we're getting closer to being able to see a time when more people are going to be able to go back to work, and there'll be more places that will be open. We're never going to be able to go back to exactly the way it was before COVID-19, but we are moving towards being on the other side of this pandemic. And I want to thank you again for all that you're doing to slow the spread of COVID-19. It is working, and I hope you feel very proud of what you're accomplishing with everyone else. And now it gives me great pleasure to introduce our District Attorney, Jackie Lacey.
Thank you. Good afternoon. I want to thank Supervisor Barger and the Board of Supervisors for their leadership. I also want to thank the healthcare providers, the grocery store workers, and everyone on the front lines of this pandemic who continue to provide essential services to the public. We, too, are an essential service provider. I have a constitutional duty to keep Los Angeles County safe from criminal activity and a moral obligation to help stop the spread of this pandemic. My office has been working closely with our criminal justice partners to make sure that victims' rights are protected and justice is well served. I have directed my deputy district attorneys to consider both the public safety and health risk in every decision they make during this time. We are doing our part to help reduce the number of low-risk, nonviolent people in jail. My attorneys have conducted individual risk assessments for about 3,500 inmates to determine who can be safely released back into our community. However, I refuse to put your safety at risk. As a result, I have opposed efforts to release defendants facing murder and other serious and violent charges. During this pandemic, my office continues to work with our criminal justice partners to explore ways to reduce our footprint in courthouses and other offices, such as holding video court hearings. We also continue to provide essential services to crime victims. We assist crime victims in securing protective orders and restitution, as well as food and shelter and counseling services. Meanwhile, my office is working to protect the public in other ways, too. We continue to prosecute domestic violence cases and child abuse cases, though we have seen a decrease in crime reporting in these categories. These crimes don't stop just because we're in a public health emergency. I want to remind you, if you are being physically abused, emotionally, or financially abused, please report these crimes to law enforcement. We will be there to help you. Finally, my office is working to stop the criminals who are using this public health emergency to take advantage of people financially, either through scams or price gouging. The fear associated with this pandemic has given scam artists new fodder, and I believe in educating the public that that's our best defense. Last week, we warned consumers about scammers trying to get money or information from consumers by offering to help secure stimulus checks. We also warned against people selling fake COVID-19 cures. I'm proud of how the people in my office have responded to these unprecedented times, and please know that we're doing our best to serve all residents of Los Angeles County. I know that together we will get through this. Thank you. Now we will take questions, and it'll be Greg who will field the questions. Thank you.
Thank you, ma'am. Our first question comes from the line of Jim Roop with Westwood One News. Please go ahead. Your line is open.
Thank you very much. Ms. Lacey, if you could hang on right there, I have a question for you. If I could get some information on the prisoner release program, I guess, as in reference to this. I guess I'm a little confused because it seems that the easiest way to stop the spread of coronavirus in the jails is to limit or stop the visitations and monitor the staff rather than let someone out who could expose themselves on a greater level to contracting the coronavirus. And also, there are many of those who are incarcerated who have pled down from their original charge. So there's a possibility there could be violent people being let out of jail if you base the release on the conviction, whatever it might have been pled down to. So could you address those two for me, please, to help clarify this?
Sure.
Thank you.
I will. First of all, that was the first step the sheriff did with regard to limiting visitors who were coming to the jail. I don't believe anyone can come visit the jail. But remember, courtrooms and jails are very crowded places. And so we had to do a little bit more in thinking down the line as to how we could preclude the spread of diseases by people being in close contact with one another. With regard to your second question, the reason the district, you're absolutely right. If you just look at the charge itself and say this person should be released, you may not have enough information. But our DAs are instructed to check out the files, to check out the prior criminal history, to look at the police reports, and determine based on all of this data and all of this information who can be safely released without anyone being harmed. And so we've done that. Our jail, we have to remember, is like no other jail. It's the largest jail in the nation. And the sheriff started out with 17,000 people, as well as all the participants who come to these courthouses throughout the county. And we as leaders decided to get together very, very early on and say, all right, anticipating down the road that this virus will spread, what can we do now in order to protect the public at large? And this was the best approach that we could take. And we are being extremely careful, and we know that there are risks associated with it, but we're trying to minimize the public safety risk to the public, but also do our best to make sure that we don't have people just crowded into a very small space and spreading this virus. Thank you.
Thank you.
We'll take the next question.
And next we turn to the line of David Rosenfeld with LA Daily News. Please go ahead.
Hi, thank you very much once again today. Wanted to ask you about one specific thing we noticed on the list of confirmed cases. There seems to be a high rate in an area known as Little Armenia. I was wondering if you had any insight into that. And then also with the trend in the deaths going up, but the number of confirmed cases staying relatively flat, I wonder what you can say about that. I mean, are there people in the hospital that are, just in such a bad condition that it's just unfortunately taking so long for them to pass away? Or, how should we be interpreting that data? Thank you.
Yeah, those are both great questions. And, I was wondering when somebody else was going to notice that there's something odd about Little Armenia. So we did look into it because you're right, the rate is very high there, and it's associated with two congregate living facilities. So that's, we just have a few cases in a couple of places, and as you know, it just takes a few cases for that rate to go high in any one of our cities or towns. So, but I appreciate that because I had noticed the same thing over the weekend and was like, what, this seems so off. But it is because we have some cases that are associated with congregate living facilities. I also appreciate the question on what's going on with the increase in the number of deaths. Because, again, it is puzzling when you see that our cases are staying relatively stable, but the number of deaths that I'm reporting every day has gone up for this entire week. I think you hit the answer to your question when you noted that sometimes people can be in the hospital for a few days before they actually pass away. And so one of the things that we're seeing is the possibility that people are in the hospital and then they go ahead and die at a later date, which would explain this lag. You know, we're not the only city to see this lag. New York City has the same phenomena, and the same thing was experienced, I believe, up in Seattle, King County, which is that you tend to see the deaths continue to rise after your cases may have leveled off. I will say that's one of the reasons why we're very focused on making sure that we are using our mortality data, the death data, to also guide all of our decisions, because it's really important to protect people as much as possible from dying from COVID-19. We'll take the next question.
And next we turn to the line of Annabelle Munoz with ABC7. Please go ahead.
Thanks for taking my question. My first question is for Dr. Ferrer. With the testing that was conducted to test for antibodies this past Friday, are you able to release any sort of information on what the findings have been so far? And my second question is for District Attorney Lacey. Is your office still pursuing cases for nonviolent or low-level offenses when that individual's only presumed offense is a nonviolent or low-level offense, or when that person has no violent record? Can you elaborate on how that's working?
You know, thank you very much for your first question on testing, which is on the serology testing, so I want to separate that from the molecular testing. But yes, we are going to be releasing information about the serology test early next week. So there's really no point in us releasing data early because it was a complex study. We collected a lot of information. I believe that we had close to 900 people that were in our sample. And so it makes sense for us to come back to you with some pretty decent information about what we learned from that study. I do want to alert everyone that we will continue to do serology testing all the way through the summer at sort of be in like 2 to 3 week intervals. So we're going to continue to test more people and get more information about the prevalence of COVID-19 across all of our communities. And now I'm going to turn it over to District Attorney.
Thank you, Ms. Munoz. I believe the question was, are we pursuing nonviolent low-level offenses? Here's what we're doing. The justice system is really sort of in a pause in as much as we are delaying a lot of those cases until a lot of the restrictions are lifted and we can get back to court. Some of the people that were released were pretrial, so their cases haven't been tried, they haven't been adjudicated. Some of the misdemeanors, some of the felonies, and we're talking about driving under the influence cases, theft cases, cases of those nature where you still need to seek justice on behalf of a victim. So we will pursue those, but for right now, we're doing our best not to put a lot of those unnecessary questions unnecessary cases into the system, and also delay it until the courts are back open and in session. Next question.
And next we turn to the line of Claudia Pashuta with KNX News Radio. Please go ahead.
Thank you. Regarding the deaths in the nursing homes and assisted living facilities, I want to confirm that it is 158 residents. There have been no deaths among staff, and given that the deaths of residents account for more than a third of the deaths in the county, I'd like to know more about what's being done in terms of checking out these facilities. Do they each get a physical on-site inspection when one case is reported, or is, how many cases does it take to prompt an on-site investigation? Have any of them been cited? Do they get continued monitoring? And then also, if we could get an update on the healthcare worker cases and the ICU beds and ventilators. Thank you.
So let me talk for a second about healthcare workers. We're going to be talking once a week and issuing a weekly report on healthcare workers. So we'll come back in early next week and give the updated totals about healthcare workers. Your question about whether we've seen any deaths amongst employees who have worked at in some of the institutional settings, I would have to confirm. I believe there have been 2 deaths amongst workers in institutional settings, but I'm not sure that any of those occurred at nursing homes or assisted living facilities. So let us get back to you on that, Claudia. And then, I think you ask the most important question for all of us is when we're seeing this extraordinarily high rate of deaths associated with people primarily living in our nursing homes, what can we do to prevent that from continuing to accelerate? And so we have added to the Department of Public Health teams, but as a reminder, we did a lot of work before we had any cases in the nursing homes, and all of the nursing homes here are inspected routinely by our health facilities inspector teams, which are made up of primarily of public health nurses. So we're in very close contact and have long-standing relationships with all of the nursing homes. And you do bring up the interesting point about that in some of these nursing homes, there have been violations in the past. Whenever there's a violation in a nursing home, it's documented by a team of inspectors, and then there is immediate follow-up to make sure that all of the corrective actions have been taken so that the nursing home can, in fact, remain open and operating. In this case, we went out, we surveyed every single 380 nursing homes and intermediate care facilities before we had cases to make sure people knew what the infection protocols were that were going to be required at these sites. And that included making sure they had capacity for isolation and quarantine. But patients are extraordinarily vulnerable, or residents are, who live here. And so it is taking an extra effort at this point. We've had to put more people on the teams so that, just like you suggested, when we do an investigation, we're able to, particularly in the higher risk settings, we're able to actually not just do the daily phone calls and the triaging and the checking in on their floor plans, but actually have a team that visits nursing homes where there have been outbreaks. So yes, our teams are out there, and we are trying to visit all of the sites that have high risk cases where people may in fact be getting infected at a higher rate than we'd like to see. I do also want to note that at this point, we have a lot of nursing homes where we're doing investigations, but in many of the places, and I want to give a lot of credit to the staff and the management teams at these sites, at many places we have not seen a high acceleration in cases. So there may have been 1, 2, or 3 cases, and instead of exploding to 20, 30, 40 cases, most sites have been able to keep the numbers relatively low. That's not really solace if you're a person that's staying in a nursing home where you're so vulnerable, or for family members, because every case is a risk. I mean, every one of the residents is in a precarious situation if they become positive for COVID-19. But I do want to give credit that there's a lot of COVID-19 in our community. It comes in mostly with employees who are doing their very best job to make sure that they're not coming to work sick, but then transmission is fairly easy in some of our settings. So thanks a lot, and we have time for one more question.
And that comes from the line of Steve Gregory with KFI Radio. Please go ahead.
Thank you, and good afternoon. Madam Chair Barger, a question that I wanted to bring up that was not answered yesterday by Supervisor Solis. I wanted to find out, within the county and the departments, which departments have been designated as non-essential, because I know there's an awful lot of departments, like, for instance, libraries, Parks and Rec, and whatnot, if there's going to be any furloughed employees. And she also said that they were reassigned. Can you give us an idea, for instance, where museum employees may have been reassigned, or where golf course people may have been reassigned? And also, what is the plan for county executives taking voluntary pay cuts to help offset the deficit? Thank you.
Thank you. So on the first part of the question, I can't speak specifically to the museum, but I can tell you that within DPSS, as well as within libraries, they have gone out and have been helping with our homeless relocation, as well as providing food for seniors. So we have redeployed employees throughout the county as essential emergency workers. As it relates to the cuts or furloughs, right now our CEO is putting together our budget, and each department is going to put together a model that's going to have a 10, 20, or 25% cut. That will include the executive office, of which the Board of Supervisors falls under it. And so as we discuss the budget, we are going to look at all options. Our first priority is not to cut services to people, because we know that many of the services in the county are for those that are the most vulnerable. And so we are cognizant of the fact that when we look at whatever furloughs, not furloughs, but budget cuts we make, we have to be sensitive to the fact that when we are going through the recovery portion of this COVID-19, that we have a responsibility to serve those people. So we will be doing that over the next few months, and so you will see that playing out. So with that, we're now going to take questions in Spanish. Was another? That was it?
No, no. Actually, I asked. My question was about voluntary pay cuts. Are there any county executives, especially those making over $100,000 up to $300,000 or $400,000 a year? Are there any executives that are going to be taking voluntary pay cuts?
And what I told you is that each department is going to put together their budget, and at this point it's premature to assume that anyone is going to have to take pay cuts, furloughs, or layoffs. I take pride in the fact that this county every year has put aside money for a rainy day, and it was just for purposes like this, where we have situations where economic downturn. In this case, it was a situation with COVID-19, and therefore I think it'd be premature to assume any of what you said as it relates to scenario is going to take place, but we have to be prepared. And so all are on the table. But I mean, to answer a question whether I'm going to require department heads or even people making X amount of dollars to take a pay cut, I think it's premature and pretty irresponsible, quite frankly. So with that, now we will do question or remarks in Spanish. Thank you.
Buenas tardes a todos. Me llamo Jackie Valenzuela y vengo del Departamento de Salud Pública. Gracias, Supervisora Barger, y la Junta de Supervisores. Estamos muy agradecidos por su liderazgo y todo lo que han hecho por los residentes del Condado de Los Ángeles durante este momento difícil. Para actualizarlos sobre nuestros números hoy, estamos tristes de reportar 55 muertes adicionales, el total diario más alto que hemos reportado. 43 de estas personas son mayores de 65 años y 39 personas son mayores de 65 años que fallecieron tenían problemas delicados de salud. Las 9 personas tenían entre 41 a 65 años y todas personas tenían condiciones delicadas de salud. No tenemos esta información para 3 casos. Y ya están siendo reportados porque son reportados por la ciudad de Long Beach y la ciudad de Pasadena. Esto eleva el número total de muertes a 455 en el condado de Los Ángeles y nuestra tasa de mortalidad para COVID-19 es 4.2%. El 88% de las muertes que murieron a causa de COVID-19 padecían de condiciones delicadas de salud, lo que subraya la necesidad de que hagamos todo lo posible para que las personas con enfermedades subyacentes permanezcan seguras en sus hogares. 2 de las muertes reportadas en el total de ayer se encontraron fuera de nuestro condado. Para las 390 muertes en las que se identificó raza, etnia, el 16% son afroamericanos, el 17% son asiáticas, el 33% son latinas, el 31% son blancas, y el 3% fueron identificadas como otra raza, etnia. Estamos trabajando con nuestros socios de la comunidad para responder a la cantidad desproporcionada de muertes entre los afroamericanos. Esto incluye abordar problemas relacionados con el acceso a las pruebas, los servicios de salud y la información precisa sobre COVID-19. El dolor experimentado por las familias y amigos de las personas que han fallecido por COVID-19 es abrumador. Juntos estamos de luto y nuestros pensamientos y oraciones están con ustedes. Hoy también estamos reportando 399 casos nuevos. En las últimas 48 horas han habido 871 casos nuevos. Hay un total de 10,854 casos en el condado de Los Ángeles. Estos casos incluyen 379 casos reportados por nuestros colegas en la ciudad de Long Beach y 184 casos reportados en la ciudad de Pasadena, que tienen departamentos de salud independientes. Estamos reportando 33 casos confirmados entre personas sin hogar. La mayoría no tenía refugio. Los 7 que fueron protegidos están adecuadamente aislados y los contactos cercanos están en cuarentena. 2,847 casos han sido en algún momento hospitalizados, el 26% de todos los casos positivos. 1,587 están hospitalizados actualmente. El 32% de estas personas están en la unidad de cuidados intensivos y el 22% en ventiladores. Actualmente estamos investigando 209 entornos institucionales con al menos un caso confirmado de COVID-19. Las cuatro investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 1,963, incluidos tanto el personal como los residentes. Los 1,050 de estos casos confirmados son residentes y los 913 son empleados. Nos entristece informar que 158 residentes han muerto por COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y vivienda asistida. Estos representan el 35% de todas las muertes. Hemos asignado personal adicional del Departamento de Salud Pública para aumentar nuestro apoyo a hogares de ancianos y centros de vida asistida. Y también hemos asignado un equipo para ayudar a garantizar equipo de protección personal adecuado para los empleados. Esperamos poder publicar informes la próxima semana que incluyen la siguiente información de sitios con casos positivos: el número de casos positivos y sospechosos entre los residentes y el personal, el número de muertes. También trabajaremos con proveedores de hogares de ancianos para aumentar los sitios que pueden atender a pacientes con COVID-19 que son positivos y que necesitan residir en un SNF o ICF. Estamos reportando 71 casos confirmados en algún momento en las instalaciones de la cárcel, los 15 reclusos y 56 empleados. La oficina del alguacil está informando para sus instalaciones. 13 reclusos actuales han dado positivo, 2 adicionales se han recuperado, 42 están en aislamiento y 943 están en cuarentena. 50 casos en las prisiones estatales, 39 reclusos y 11 empleados. Y 4 casos en instalaciones juveniles, todo dentro del personal. Publicamos una lista de instalaciones con casos confirmados en nuestro sitio web una vez que se ha notificado a todo su personal, residentes y familias. Y puede ver el informe actualizado de todos los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud Pública en publichealth.lacounty.gov. El Departamento del Alguacil del Condado de Los Ángeles informa 38 casos positivos entre el personal, 458 empleados están en cuarentena y 294 empleados han regresado a trabajar. El Departamento de Bomberos del Condado de Los Ángeles informa 17 casos positivos entre el personal, 16 aislados en el hogar, 3 enfermos en el hogar y 14 que han regresado a trabajar. Gracias al Sheriff Villanueva y al Jefe Osby por rastrear e informar estos datos. Más de 70,000 personas han sido evaluadas y se han reportado resultados en el Condado de Los Ángeles y el 11% fueron positivas. Se abrieron 3 nuevos sitios de pruebas esta semana para aumentar la disponibilidad de pruebas para individuos sintomáticos. Mañana el doctor Kathryn estará aquí para hablar más sobre la capacidad de pruebas en el condado de Los Ángeles. Quería aclarar cualquier confusión que pueda haber en torno a las pruebas y los diferentes tipos de pruebas que todos estamos escuchando. Si tiene síntomas y desea hacerse la prueba de COVID-19, debe hacerse la prueba con las pruebas moleculares que están utilizando los proveedores en los sitios de prueba en todo el condado. Esta prueba le indica actualmente si es positivo o negativo para COVID-19. Estas son las únicas pruebas que son apropiadas para diagnosticar COVID-19 en este momento. Ayer hablamos sobre nuestro estudio que probó una muestra al azar de residentes del condado de Los Ángeles con pruebas de serología. Lo que aprenderemos de estas pruebas es quién en algún momento ha sido infectado con COVID-19. La prueba no detecta si el virus está actualmente en su cuerpo. Solo muestra si su cuerpo desarrolló anticuerpos en algún momento en respuesta al virus. No nos dice si esta persona actualmente es positiva para el COVID-19. Desafortunadamente, ni siquiera nos dice si una persona ha desarrollado inmunidad al COVID-19. Lo que hace es brindarnos información valiosa sobre cuántas personas han sido infectadas con COVID-19 en el condado de Los Ángeles, independientemente de si alguna vez se enfermaron o si alguna vez se hicieron la prueba. También nos dará información acerca de cuáles grupos han sido afectadas por las infecciones de COVID-19. Estamos ansiosos por compartir con ustedes los resultados preliminares de este estudio a principios de la próxima semana. Pero como recordatorio, para el diagnóstico, las pruebas de serología no son apropiadas. Las pruebas moleculares que utilizan los proveedores y los sitios de prueba son la prueba correcta para diagnosticar a una persona con COVID-19. Quiero agradecer al doctor Kathryn y al Departamento de Bomberos por aumentar significativamente la capacidad de las personas sintomáticas para ser evaluadas mediante la creación de centros regionales de evaluación a través del condado. Muchos de estos sitios tienen espacios de citas disponibles para personas con síntomas que necesitan hacerse la prueba. Vaya a covid19.lacounty.gov/testing, TESTING, para obtener una lista de los sitios de prueba y para programar una cita en línea. Quiero mencionar que si su ingreso se ha visto afectado por la pandemia de COVID-19 y usted está embarazada o tiene un hijo menor de 5 años, WIC, por sus siglas en inglés, puede ayudarlo. WIC significa Programa Especial de Nutrición Suplementaria para Mujeres, Infantes y Niños. Proporciona beneficios alimenticios y otros recursos para familias elegibles. Para saber si es elegible, puede llamar al 888-942-2229 o visitar phfewic.org. Todos los días nos acercamos a tener más personas de regreso al trabajo y más lugares abiertos. No podremos volver a ser como éramos antes de COVID-19, pero estamos avanzando para estar del otro lado de esto. Quiero agradecerle nuevamente por todo lo que están haciendo para frenar la propagación de COVID-19. Está funcionando y espero que se sientan muy orgullosos de lo que estamos logrando juntos. Y ahora les presento a Ricardo Santiago, oficial de Información Pública de la Oficina del Fiscal del Distrito.
La fiscal de distrito, Jackie Lacey, quiere agradecer a la supervisora Barger y a la Junta de Supervisores por su liderazgo. También agradecer a los proveedores de salud, empleados de supermercados y a todos los que están proveyendo servicios esenciales durante esta pandemia. Nosotros en la Fiscalía también somos proveedores esenciales. La fiscal Lacey tiene el deber constitucional de mantener al Condado de Los Ángeles libre de actividad criminal y una obligación moral de ayudar a detener el esparcimiento de esta pandemia. La Fiscalía ha estado cooperando con nuestros socios en el sistema de justicia penal para asegurarnos de que los derechos de las víctimas sean protegidos y que se haga justicia. La fiscal Lacey le ha ordenado a sus fiscales asociados que consideren la seguridad pública y los riesgos de salud cada vez que toman una decisión durante esta crisis. Estamos haciendo de nuestra parte para poder reducir la cantidad de prisioneros en la cárcel por crímenes no violentos y de bajo riesgo como respuesta a esta pandemia. Los fiscales han llevado a cabo una asesoría del riesgo que presentarían unos 3.500 reclusos para ver si pueden ser liberados a la comunidad de una manera segura. Pero la fiscal Lacey rehúsa poner la seguridad de todos ustedes a riesgo. Así que como resultado, se ha opuesto a dejar ir a acusados quienes se enfrentan a cargos de asesinato u otros crímenes violentos y serios. Durante esta pandemia, la Fiscalía continúa trabajando con nuestros socios en el sistema de justicia penal para reducir la cantidad de personas en nuestras cortes y oficinas, haciendo cosas como presentaciones de cargos por video y otros trámites legales a través de videoconferencia. También continuamos proveyendo ayuda esencial a las víctimas del crimen. Ayudamos a las víctimas del crimen buscando órdenes de protección, restitución, además proveyendo alimento, albergue y servicios de consejería. Mientras tanto, la Fiscalía continúa protegiendo al público de otras maneras. Continuamos enjuiciando casos de violencia doméstica y abuso de menores, aunque hemos visto una reducción en los reportes de estos tipos de crímenes. Estos crímenes no paran de suceder solo porque estamos en una emergencia de salubridad. Si usted está siendo abusada o abusado física, emocional o financieramente, por favor, reporte estos crímenes a la policía. Estamos aquí para protegerles aún en medio de estos tiempos de incertidumbre. Finalmente, la fiscal Lacey está tratando de detener a criminales quienes utilizan esta emergencia de salud pública para aprovecharse de las personas financieramente, ya sea mediante estafas o mediante el aumento ilegal de precios. Los temores que van con esta pandemia le han dado combustible a los estafadores. El fiscal Lacey cree que educar al público es la mejor defensa. Por eso, la semana pasada advertimos a los consumidores sobre estafas en las que ladrones tratan de conseguir dinero o información de las personas, ofreciendo ayudar a conseguir el cheque de ayuda federal. También advertimos a las personas de la venta de curas falsas para el COVID-19 mediante nuestras alertas de fraude. La fiscal añadió en su declaración que está orgullosa de cómo sus empleados han respondido en estos tiempos nunca antes vistos. Y quiero que sepan que estamos haciendo todo lo que podemos hacer para ayudar a todos los que vivimos en el condado de Los Ángeles. Juntos lograremos sobrepasar esto. Greg, we're ready for questions in Spanish. There are no more questions now. We follow it up with our Armenian speaker, right?
And thank you. We have no questions in queue at this time.
Now I'd like to introduce our Armenian speaker, Yaran Avazian from Public Health.
Բարի երեկո։ Գուզենք թարմացնել LA շրջանի ընթացիկ կարգավիճակի վերաբերյալ։ Մենք այսօր ցավով կհայտնենք հավելյալ 55 անձերի մահվան մասին, որոնց 43-ը 65 տարեկանից բարձր էին, իսկ 39 նրանից հիմքուն ունեին այլ առողջական վիճակ։ Իսկ 9 նրանից 41-ն 65 տարեկի մեջ էին եւ նրանից բոլորը հիմքում ունեին այլ առողջական վիճակ։ Դերակցություն մենք չունենք մյուս 3 դեպքերի մասին, քանի որ դրանից 2-ը հայտնվում են Long Beach-ի քաղաքում, իսկ մյուս մեկը Pasadena քաղաքում։ Սա հանգեցնում է մահացությունների ընդհանուր թիվը 455-ի Լոս Անջելես համայնքում եւ մեր մահացության մագարտակը COVID-19-ի համար կազմում է 4.2 առ 100։ Ամեն օր, երբ մենք հայտնում ենք այս թվերը, մենք գիտենք, որ կան ընտանիքներ եւ ընկերներ, ովքեր սգում են իրենց սիրած մեկի գորուստը, դուք մեր մտքերի եւ աղոթքների մեջ եք։ Այսօր մենք հայտնում ենք նաեւ 472 նոր դեպքերի մասին։ Ուրեմն վերջին 48 ժամվա ընթացքում գրանցվել է 871 նոր դեպքեր։ Ընդհանուր առմամբ LA County-ում կա 10,854 դեպք։ Այս դեպքերը ներառում են Long Beach քաղաքում մեր գործընկերների կողմից գրանցված 379 դեպքեր եւ Pasadena քաղաքի կողմից գրանցված 184 դեպքեր, որոնք ունեն անկախ առողջապահական բաժանմունքներ։ Հոսպիտալացման դվյալները 2847 դեպք հոսպիտալացվել է, որ կգազմի բոլոր թրական դեպքերի 26 առ 100-ը։ Ներկայումս 1587-ը հոսպիտալացված են։ Այդ մարդկանց 32 առ 100-ը գտնվում է ICU intensive խնամքում, իսկ 22 առ 100-ը օտափոխիչների վրա։ Տեստավորում LA County-ում ավելի քան 70,000 մարդ փորձարկվել է եւ ստացել են արդյունքների մասին լուրը, որոնց 11 առ 100-ը թրական է։ Տեստավորման շուրջ ավելի շատ բարձություն։ Ուզում ենք հստակացնել որևէ խառնաշփոթի, որը կարող է լինել փորձարկման եւ տարբեր տեսակի թեստերի մասին, որոնց մասին մենք բոլորս լսում ենք։ Այս շաբաթ բացվել է 3 նոր փորձարկման կայան սիմպտոմատիկ անձանց տեստավորման գոյացման համար։ Եթե դուք ունեք ախտանիշներ եւ ցանկանում եք ստուգվել COVID-19-ի համար, ապա դուք պետք է փորձարկվեք այն մոլեկուլային թեստերի միջոցով, որոնք օգտագործվում են մատակարարների կողմից եւ հանրապետության ամբողջ փորձարկման վայրերում։ Այս թեստը բարձում է ցեզ, թե արդյոք դուք ներկայումս թրական կամ բացասական եք COVID-19-ի համար։ Ուզում ենք թարմացնել ցեզ անցած շաբաթ մեր նշած seroprevalence ուսումնասիրության վերաբերյալ, որը միկրոբի մագարտակը բնակչության մեջ ինչպես չափվում է արյան շիջուգում, այսինքն blood plasma-ի մեջ։ Լոս Անջելես նահանգում բնակվող 1000 մեծահասների բադահական նմուշը տեստավորվելու է COVID-19-ի համար, օգտագործելով հագամարմինների թեստ, որը նույնպես կոչվում է որպես սերոլոգիական թեստ։ Սա դարբերում է մոլեկուլային թեստերից, որոնք մարդիկ ստանում են որոշելու, թե դրանք թրական կամ բացասական են COVID-19-ի համար։ Սերոլոգիկական թեստը չի հայտնաբերում վիրուս եւ չի ախտորոշում այն անձին, ով ներկայումս թրական է COVID-19-ի համար։ Փոխարենը, այն չափում է հագամարմինները վիրուսի դեմ եւ դա թույլ է տալիս մեզ հայտնաբերել ինչպես ընթացիկ, այնպես էլ անցյալի վարակները։ Սա մեզ արժեքավոր դերակցություններ կտան այն մասին, թե քանի մարդ է վարակվել LA County-ում COVID-19-ով, անկախ նրանից, թե նրանք երբևէ հիվանդացել են։ Մենք սկսեցինք տվյալների հավաքագրումը անցած ուրբաթ եւ այն ավարտեցինք երկուշաբթի գիշեր եւ հուսով ենք, որ կկարողանանք հրապարակել նախնական արդյունքները հաջորդ շաբաթ։ Մենք կշարունակենք կատարել այս հետազոտությունները մոտավորապես 3 շաբաթը մեկ կոնե մինչև ամառ։ Մենք հուսով ենք նաև ընդլայնել դվյալների հավաքագրումը խոցելի համայնքներում եւ իրականացնել թիրախային ուսումնասիրություններ բարձր ռիսկային խումբերում, ինչպիսին են առողջապահության աշխատողները, առաջին պատասխանողները, հմուտ բուժք ու իրական հաստատություններում աշխատողներն ու բնակիչները, ինչպես նաև նրանք, ովքեր ապրում կամ աշխատում են ժողովի այլ վայրերում։ Ինչպես նշեցինք, այս թեստը չի օգտագործվում COVID-19 ունեցող մարդկանց ախտորոշման համար։ Չկան սերոլոգիկական թեստեր, որոնք FDA կողմից հաստատված են ախտորոշման համար։ Նաև այս ուսումնասիրությունը մեզ չի բարձի, եթե մարդիկ անձերն մխելի են դարձել COVID-19-ով, եթե վարակվել են։ Բայց, որպես հիշեցում, ախտորոշման համար սերոլոգիկական թեստերը դեղին չեն։ Մոլեկուլային թեստերը փուշ աշխատողների և փորձարկման գայրերի կողմից օգտագործվողները թեստ են COVID-19 ունեցող անձի ախտորոշման ճիշտ ստուգումին։ Ուզում ենք շնորհակալություն հայտնել Դոկտոր Գազանին և Հրշեջ ծառայության սիմպտոմատիկ մարդկանց թեստավորման բարգավաճումի համար, ստեղծելով տարածաշրջանային փորձարկման կենտրոններ ամբողջ երկրում։ Խնդրում ենք անցնել covid19.lacounty.gov/testing փորձարկման վայրերու ցուցակի և ժամադրություն վերցնելու համար։ Week. Ուզում ենք նշել, որ եթե ձեր եկամուտը աստվել է COVID-19 համաճարակի պատճառով և դուք հղի եք կամ 5 տարեկանից ծածր երեխա ունեք, Week-ը կարող է օգնել։ Week-ը, որը կոչվում է կանայք, նորածիններ և երեխաներ, ապահովում է սննդի արտոնությունները և այլ աղբյուրներ իրավասու ընտանիքներու համար։ Որպեսզի իրավասու լինեք, կարող եք զանգահարել 888-942-2229 կամ այցելել phfewic.org։ Ամեն օր մենք ավելի ենք մոտենում, որ ավելի շատ մարդ վերադառնա աշխատանքի և ավելի շատ դեղեր բացվի։ Մենք ի վիճակի չենք լինի վերադառնալ այն ճանապարհին, ինչպիսին էր COVID-19-ը նախքան, բայց մենք շարժվում ենք դեպի այս ամենի մյուս կողմը։ Ուզում ենք մեկ անգամ ևս շնորհակալություն հայտնել ձեզ այն ամենի համար, որ դուք անում եք COVID-19-ի տարածումը դանդաղեցնելու համար։ Այս աշխատում է և մենք հույս ունենք, որ դուք շատ հպարտ եք զգում այն բանի համար, ինչ մենք միասին ենք իրականացում։ And this concludes our briefing for today. Thank you.